Trailblazers, thank you for coming back to another episode. Today I have Nicolas Hulscher, epidemiologist, and he is returned to the show to go over his autism finding studies, which they have conducted. We're going to go over the results, your findings, and we did talk about a few other things offline that we will get into, Nick. So, but first I want to start with autism, and I just want to publicly tell everybody that we've been having some technical issues before we recorded, so I'm big shout out and thank you to Nicholas for being patient and waiting on me here. So Nicholas, let's talk about your study, man. I'm glad you came back and appreciate that you agreed to be here.
Yeah, well, thanks for having me. And I'll give just a brief overview and then we'll dig deep into each domain of the study. So,
yes, sir.
We did perform the most comprehensive analysis to date, and authoritative and extensively referenced on the possible causes of autism. We found over 300 studies in the peer-reviewed literature looking at what's causing autism. And we identified about 9 different distinct domains of areas of concern. And so we found one that was dominant, and that was vaccines. I just want to lay that out first. And so, but let's go through the smaller pieces of the pie that appear to slightly increase risk or increase susceptibility to developing autism after a battery of vaccines. So first we have genetic susceptibility, right? So there's many different things, what's called genetic polymorphism. So the MTHFR gene, when there's a common variance in that can affect folate processing in the baby. Folate's essential for brain development. And so when that's affected, that can increase this susceptibility for sure. And then we have things such as siblings with autism, so what's called sibling reoccurrence. If your sibling does have autism, there's about a 20% chance you will also have autism. This is documented in multiple studies now that were very robust. And then we have other things such as older parents. So if you have a baby, you're over 40 years old, there is increased risks of these adverse neurodevelopmental outcomes. So we have those bases covered, and then we moved into the environmental toxicants. So this includes things such as pesticides, right? Glyphosate. This has increased widespread since the 70s. It's documented in rats to literally cause autism-like behaviors when they're exposed. And then there's some human epidemiological data showing associations between heavy pesticide use and higher rates of autism. And then we also have PFAS. This is these forever chemicals that are basically everywhere in the environment now. They're highly toxic. And then we have things such as phthalates. These leach from PVC piping, which have been widely used. So we are consuming those. It's in many other products as well. And we have heavy metal release from factories. If you live near a factory that releases mercury, there is a higher chance you can develop autism as you breathe that in on the daily. And then so we move from environmental into in utero drug exposures. There's about 30 drugs that have found possible associations to neurodevelopmental disorders, including autism. These include antidepressants, so SSRIs, SNRIs, as well as anti-seizure medications, anticonvulsants, antipsychotics, and opioids, as well as acetaminophen or these fever reducers. All of these drugs appear to increase susceptibility. But then we got to vaccines. And these were by far the most dominant risk factor, simply because we found over 107 studies linking vaccines to neurodevelopmental disorders and autism. And this spans from epidemiological population level data down to biological and mechanistic data. They inject the mice with aluminum or thimerosal, literally induces autism-like behaviors. And then you move down to the case reports, real clinical case reports of patients developing autism after a battery of vaccines. And lastly was the strong, extremely strong temporal correlation between the rise in autism cases and the expansion of the childhood vaccination schedule. This was almost perfect, literally in parallel. You'll see it in our figure in our paper. Since 1986, when the National Childhood Vaccine Injury Act passed, vaccine makers got full legal protection against injuries, so they could injure as many kids as they want. And that's how we got up to 32 doses by age 2, now 72 doses by age 18. And now, in parallel, autism also increased to now 1 in 31 children. Nothing else could explain as strongly this increase in autism.
I'm actually glad you brought up the number of vaccines because I was literally going to discuss that because last time you were here, you did mention about there being a 72 vaccine schedule by the time you're 18, which is crazy. Couple questions because there's a lot to unpack. I'm not sure if there was a correlation between a specific vaccine or was it just a combination of vaccines built up over time that contributed to autism?
Yeah, that's a hard one to pinpoint. We believe it's a combination of all of them. We have to remember the only ones that have been studied for autism were MMR, hepatitis B was studied a bit, and that's it. Literally, you have
That's
all
it?
like the 20 other types of vaccines. They didn't even look.
Huh.
So I mean, and so when they claim vaccines don't cause autism, they look at 29 studies that we also have in our report that found no association. Those were only looking at MMR for the most part, and hepatitis B, and those were riddled with fatal flaws. They don't even have unvaccinated control groups. They simply, you cannot assess risk without a real control group.
Right.
And so that's what they're basing that off of. But yeah, it's important to note there were also many other studies that did find strong associations between MMR and hepatitis B and autism.
So as of now, it's just a culmination of buildup of all these vaccines, one after another on top of another that seem to be contributing to autism. Is that correct?
It's no specific antigen in
It's
these
just a
vaccines.
combination.
Yeah, it's the combination of everything in these shots. So you go through the list, it's very disturbing what's in these. So obviously you have the viral antigens, right? That will invoke inflammation and strong immune response, but that's just part of it. You have the aluminum adjuvants.
Right.
You used to have the thimerosal. Both of these are highly neurotoxic. They deposit in brain tissue. You have those, and then you also have formaldehyde, which is literally a carcinogen. There's trace amounts of that in most of these vaccines. You have polysorbate 80, which is a organ toxic emulsifier. You also have neomycin, which is a highly neurotoxic antibiotic getting injected directly into children. And you have fetal DNA cells. There's trillions of DNA fragments from fetal lung tissue from the 1960s in these vaccines. They use it at the factory. They use these fetal lung cells to churn out viral antigens to be placed in the vaccines.
Really
So you have
quickly.
all this stuff.
Yeah, Nicholas. Real quickly. So when in using fetal DNA in these vaccines, how does that affect the person receiving this vaccine? How does that interact with the other person's body?
Yeah, we believe it does in some cases integrate into these children's genomes because there was a 2015 study we included in our report. These guys are the ones that found the trillions of DNA fragments, but then they looked in human cells as a side test in the same study. They exposed these human cells to these DNA fragments, and they literally took them up into their genome by up to 0.6% of the entire genomes of these cells in the test tube became that fetal DNA. So you're literally just pumping these babies in with a different human's genes. And so we have no clue really what the implications of that are, but they did find that this actually did disrupt genes that have been linked to autism. And so this can definitely be playing a role. And this fetal DNA is found in the MMR vaccine. They use it for the rubella component as well as the hepatitis vaccines.
Interesting. All right, let's get back to the brand that people know, which is the whole Tylenol thing. and of course, that's just the brand. So I'm not saying Tylenol in general, but they're just the brand of. Um, how has that been attributed in your findings to autism? Did you find, or was the foundation able to find a correlation between the use of, let's say, products like Tylenol and autism while someone is pregnant, for example?
Yeah, we include all the studies on this in our report. There's a study by Prada and colleagues that did a systematic review of this. And they did find, a decent portion of studies that looked did find a positive association with Tylenol and autism. But then we looked closer, another study came out with what's called sibling controls, where one sibling was exposed to the Tylenol, the other wasn't, and then they found no association. So regarding Tylenol, we believe it is definitely not good for a pregnant mother to take. It can interfere with different gene expressions in the developing fetus. It is obviously toxic to the liver, and this can deplete the body's detoxification system. But what we found the most important aspect with Tylenol was it appears to be serving as an amplifier of risk to develop autism when combined with a battery of vaccines. We have to remember every single study that looked at acetaminophen, Tylenol, and neurodevelopmental outcomes, not one of them, not one accounted for vaccines, not one. So you can't. So those same children, those same mothers, they were also receiving batteries of vaccines. Pregnant women, they get 4 vaccines during pregnancy. So it's very hard to assess that causal relationship. But there was a study by Schultz and colleagues. So actually one study did control for vaccines, and they found when you take Tylenol before MMR, it does amplify risk of autism by like 500%. So
So in
it appears to
combination
be
with
an
the
amplifier.
MMR vaccines, it did contribute towards autism?
Yeah, when it's combined with all these other things, but we were unable to identify a case report of like a child just taking Tylenol and developing autism just from taking the Tylenol alone. But it definitely appears to be able to increase susceptibility, particularly if the pregnant mother's taking them all the time in high doses. That's obviously not going to be good for the developing
No.
brain.
No. So what do you say to the reports that have come out? Here's one thing I notice about the foundation, McCullough Foundation, is when you guys do a study and you release your findings, all of a sudden there's a bunch of groups that come out to try to rebut your findings. And how convenient that you came to the end of this study in autism, and then right away I saw people on social media right after you started doing your podcast tour saying, "Oh, there's no link between Tylenol and autism. They're trying to debunk this, debunk that." But yet you guys do rigorous studies, like you don't just rely on one result. Like you just keep going and going and comparing other studies and findings, not even just your own, but from other organizations, from other people. So what do you say to those people out there that are deliberately going out of their way to debunk the McCullough Foundation and everything that you guys are doing?
Yeah, so we have disturbed a deep ideology that's been embedded into people's minds since 1998, when Dr. Andrew Wakefield published the seminal report documenting regression of children into autism shortly following MMR. There was this whole campaign. His paper was in the Lancet for about 10 years. They retracted it. And then ever since, they began an entire propaganda campaign to not only smear him and say he's some sort of abuser, they smeared him in an attempt to solidify in the minds of people that this was all debunked. There's no possibility at all that these children became autistic from the vaccine. And it's been a repeated lie from the mainstream media outlets for 20 years. And they haven't stopped. And so it is programmed into people's minds that this is impossible. And it's a very hard thing for people to come to terms with, particularly now that we have all of this evidence. It's very clear, right? We can't just use ad hominem attacks. That's what appears to be what most of the attacks are. They say we've been debunked. They say we're frauds. They say all sorts of things, but a lot of the time they don't even look at the studies. They don't even read the report. But when they do read the report, they claim that the 107 studies are all bad. And then they point to their population study that claims no association, even though that study doesn't even have a control group. And in fact, the control group they claim was partially vaccinated, but actually it was about 70% in this Danish cohort were actually vaccinated. So you know, it's garbage. It was these studies were intentionally designed to find no association, and the strongest studies yet. And they never mentioned this, and this is important. We have a table in our report of all 12 of the real vaccinated versus fully unvaccinated studies. So there were 12 of them with these real control groups. And all 12 of them found the unvaccinated were far, far healthier in every single domain. They had far less autism risk, far less neurodevelopmental disorders, including tics and ADHD. They had far less autoimmune disease, less asthma. The unvaccinated had less skin disorders. They were healthier in every single domain. And so it was quite undeniable. And so, yeah, they never mentioned that part.
Of course not. And the other thing about all this that I've noticed is it's always very timely. It's always very, coincidental, right? But the reality is, how much of this can we attribute to big pharma just pushing back, right? Who's funding these studies? A lot of people don't even look into that either. And of course, a lot of studies I've noticed have always come out to make the big pharma corporations look like, hey, they everything they've done is legit, it's on the level. And, it just seems like a very timely, coordinated effort to discredit your work, which is ridiculous to me, given everything that you guys do, like everything that you guys do to make sure that you are on the level, that you're comparing everything from all sides to make sure that you can come to a logical conclusion, not just based on your opinion. So hats off to you guys. Just keep doing it. And, I just thought I'd get your opinion on that situation because it just always seems very, like I said, coincidental. All of a sudden, hey, there is no study linking this to that or X to Y or whatever, which is ridiculous. So as far as the Tylenol thing, we're gonna lay that to rest because you've explained it, and it sounds to me though like autism, aside from vaccines. Aside from drugs, like the opioids, the SSRIs, etc., much of it is environmental as well. Everything down to what's around you, what things are made of, such as plastics, for example, everything that's leaking into your water, your food supply, your diet, for example, correct? So when we're talking about children who have bad diets, and I brought that up because you mentioned before about your gut biome, right? Like your makeup in your gut and how that affects your health and how that can also lead towards autism-like symptoms. Can you please expand on the environmental aspect and as well as the food, for example?
Yes. So the environmental aspect is not directly causing autism in children. It is simply put just increasing susceptibility, and probably in many or in a minority, a small number of cases may be directly causing autism, particularly in the womb if they're exposed to so much of this environmental toxicants. It may play a small role in directly causing it in some instances, but we believe this is just drastically increasing susceptibility. And so, because when a child has all of this toxic burden from all of these toxicants, which we know for sure it's everywhere now, and you mentioned plastics, microplastics, they're everywhere now. They're in every organ system of humans. Every time they look, they find it. They find it in the brain. They find it, and it's increasing over time. So each year they look, there's more plastic in the brain and nanoplastics. This has all been linked to autoimmune diseases and even cancers now. So yeah, that's very serious. So since that's in the baby, since the glyphosate's in the baby, kind of circulating, the mother's eating garbage, and then the baby's born. Their detoxification system, it's trying to deal with all of this stuff, and so as it's doing that, it doesn't have enough capacity to handle 8 vaccines at one visit, which directly just injects them with all the toxins I mentioned earlier. Like it's probably, if you give 8 vaccines, it's going to be like 50 toxins just directly entering the central nervous system. It can't handle it. The baby cannot handle that, and it will cause neurodevelopmental injury. It will literally reduce the number of neurons through encephalitis. The brain becomes severely inflamed, and this does result in neurite disintegration, which is kind of the branches at the end of the neurons literally just kind of wither away. And so that's what happens. And that's why we see these manifestations of the psychiatric disorders, right? It's not just, some magic thing. It's brain damage, unfortunately.
But all right, so environmental factors can make one susceptible. So it sounds like there's not any one thing, for example, it's just a combination. So while the body's trying to handle everything that's being thrown at it based on the environment, the toxins that are in the environment, your body's busy. It's trying to deal with one thing, can't process the other, right? Is that what you're saying? Is it kind of as simple as that? I'm just trying to simplify it.
Yeah, well, it is so complex, and we don't know which single environmental component would be contributing the most. So we have to kind of group them and say that they are all contributing, because they all are obviously and verifiably toxic to the central nervous system. So yeah, that appears to be what's happening. It's increasing this susceptibility in combination with the genetic susceptibility. If you already have a high chance of developing this autism, like if you had the older parents, or if you had these genetic polymorphisms and MTHFR, and then you are exposed to the plastics, the pesticides, and then you kind of go through all of this. You were born with some mitochondrial deficiencies. And so if you have all of that, that increases your risk on the vaccine side to regress into autism after those vaccines.
Okay, so we're talking about in the womb, but how about a developing child once they're born, they're growing up? Like as you're developing, you're still very susceptible to many things, correct? You're not fully developed. Your immune system isn't. Your neural system's still developing. Your heart, everything. How's that affecting a growing child?
Yeah, so all of these exposures are severely affecting the environmental and iatrogenic drugs and vaccines. They all do severely interrupt the brain as they are undergoing these critical neurodevelopmental windows. And so this is the worst time to batter them with these vaccines.
Right.
Literally the worst time. They can't handle it. I mean, it's just absolutely ridiculous. And so, and I know you mentioned earlier you wanted to speak upon the gut-brain axis.
Right, I do.
This is important. And the gut doesn't necessarily just become dysfunctional from nothing. That also appears to be a factor of all the other things we talked about, but particularly pesticides and antibiotic exposure. So antibiotics, a lot of small children end up taking them. Mothers take them.
Lots of it.
Yeah, and that just wipes out the entire microbiome. It's not going to recover. All the beneficial keystone bifidobacteria strains will be eliminated. Actually, 25% of children now in the U.S. have zero bifidobacteria, which is critical for neurodevelopment, immune development. So you wipe that out. And there is a strong connection between that gut, those microbiomes, or your microbiome, and the brain. It interacts, and that's now been proven. And so you disrupt one, that communication is going to get thrown off. And we see somebody named Dr. Sabine Hassan. She documented improvements in autism symptoms when she does a fecal transplant, or what's called a microbiome transplant. So we know that this definitely does play a key role. Dr. Andy Wakefield, like we spoke earlier, who made the first observation, all of those kids that developed autism after the vaccines had disturbed guts. They had severe gut issues and irritable bowel syndrome and inflammation in the gut. So yeah, that becomes disturbed. The gut barrier becomes disrupted, and so all the pathogens, like when they eat food, and all the metabolites from the bad bacteria, these what's called lipopolysaccharides, all this stuff just enters through the gut barrier because it's disrupted and reaches circulation, and that can harm the central nervous system.
I'm aware of the gut issue because I had a weird issue not that while back, so I went down this rabbit hole, and everything you talked about I looked into because it's interesting to find out how your gut biome, its makeup, how it affects the rest of your health in your body. And if that's disrupted, like you said, especially when we're talking about the case of a developing person, a child, that can totally affect their mental development as well. Um, has there been a case though, because we're talking about autism and development and brain function, has there ever been a case where as an adult they have slipped into that direction of becoming autistic or having any other issues mentally due to, like, we're talking about prolonged bad diet, prolonged exposure to, SSRIs, depressants, etc. Does any of that also affect outside of vaccines? Because I know vaccines are a big thing, but do these other factors also contribute to mental health as well as development as a human being? Like once we're grown, once we're past 18 years old, for example.
Yeah. Many of these drugs, particularly SSRIs, these antidepressants, antipsychotics, when adults take these, they don't regress into autism, and start forgetting words. But it is a possibility. But the thing is literally no adult's going to be diagnosed with autism after like 40 years. The doctors, they're not going to suspect that, but we can't eliminate that possibility of neurological damage after a lot of this stuff, even as adults. But
so we don't know because doctors wouldn't look for it anyway.
Yeah, like it's literally unheard of diagnosing like a 40-year-old adult, with autism. But they will suffer other neurological damage from these things and suffer all sorts of things. Many people on SSRIs, they become, blunted. They sometimes literally change their entire personality, irreversibly changes in some individuals. They get persistent sexual dysfunction. And then sometimes they become homicidal. And so that was documented in 2 large Swedish studies. And so, yeah, these drugs, they can definitely change mental health quite drastically. But yeah, they're not necessarily develop autism, but that's actually something that should be looked into because, yeah, I'm not aware of. And I don't like to, completely rule anything out. Like, the other side always likes to say, this doesn't do that for sure. This doesn't do that for sure. So we can't really rule that out. But
I haven't heard of it either. So that's why I'd ask. I don't know if that was anything that was ever brought up within your circles. Like, because it seems like after you get past a certain age, they don't even bother to look. They don't bother to study. They just think, oh, you're already developed. You're just getting old, whatever. But we can't rule out that these things don't continue to affect us as we become an adult. I mean, it's absolutely possible. So
yes,
hopefully someone takes that mantle up and starts these studies because it would be very revealing, I would think.
Well, autism is such a wide-ranging disorder. It's such a wide spectrum, and it's many different neurological diseases, just kind of thrown into one group.
Gotcha.
And so, yeah, that's why it is definitely possible, because we really don't know the exact disease. Like, we cannot go to a child with autism, look in his brain, or we can't go look in anybody's brain and say, his brain shows this, he's autistic. We don't have that
Not yet.
capability yet.
Yeah.
So, and sometimes they don't even find anything in the brain when they look.
Is
So it's-
there a way to sorry, I keep cutting you off, man. Apologies, Nicholas. But is there a way genetically to find out if anyone has a predisposition towards autism or would have autism based on their DNA?
Yeah, there are some common genetic polymorphisms, or what's called like your genes. And I mentioned it earlier. One key one is what's called the MTHFR gene, which is central to your body's ability to process and utilize folate, which is a vitamin used for neurodevelopment. And so all and other genes that will also have these sort of changes that are critical for kind of developing the neurological system. If those are also kind of changed from the normal, though that can definitely increase the susceptibility. And you could say like, listen, this kid will be at a higher risk, but also particularly when they're born and they have gene dysfunctions related to detoxification, particularly the cytochrome P450 system. If there's abnormalities detected there, that is also a very key indicator that they'll be susceptible to developing autism from vaccines. Because then you'll know they won't be able to detoxify it. And so, yeah, there are markers you can look for. If a parent really wants to vaccinate their child so bad, that type of risk stratification of looking at those susceptibilities would be indicated. But, nobody's doing that. These doctors are just pumping them with everything they've got on the shelves, following the disastrous CDC ACIP schedule with no personalization. And that's why we see this autism epidemic.
Right. So, but aside from your body's ability to process toxins, for example, and which will lead to how your brain is developed, et cetera. There's not like a genetic marker for like blue eyes or blonde hair, for example, that you can look for in autism. Not like an autism, like a specific autism marker that can be identified.
There's some that have been associated,
but not like when you look at it, say,
nobody's nobody's been able to identify like, oh, this is it. Like this is the gene that's going to do that. But yeah, I would say the strongest one is the MTHFR gene for sure. That's been talked about the most and studied a lot. And there's a few others, but yeah, we can't really look at that and say for sure. And it's definitely not the cause of the autism epidemic. Children all of a sudden having these gene polymorphisms, and that's not why we're seeing this. We're seeing this autism epidemic because of neurological injury.
All right, so let's sum this autism stuff up here. Your study. So it's basically, if I'm correct, please correct me. It's due to the outside attacks on the body as they're being developed through all of these drugs and vaccines that are interrupting the development of a child that could lead to autism. Am I on the mark there?
Yep. It's all of that stuff. All of that stuff increases susceptibility, and then the vaccines push over the tipping point and trigger. So the main pathway to autism is it starts with the battery of vaccines. The child develops, and this is documented in the verified published case reports. They get the battery of vaccines. They get a very high fever, and then they develop febrile seizures due to this high fever. And so they start seizing up. And when they start to seize up, that also incurs neurological damage. And then they recover. But once they recover, they've developmentally regressed. They stop learning. They forgot words. Sometimes they don't even remember. They can't make eye contact anymore. And so that's usually around the time when they'll be diagnosed with autism. And so, again, and that febrile seizure is also related to what's called encephalitis, which is that inflammation of the brain. And so it appears that autism, in most of these cases we're seeing now, is a form of post-encephalitic state or post-brain inflammation state, where they literally have incurred this neuronal tissue damage.
That's interesting. Yeah, that's crazy. So we're gonna wrap this up. So you've said a lot. I want to make time for the other findings and updates that you had mentioned before we started recording here, and I want to give you the opportunity to go over those. So I'll give you the floor, however you want to lead off on this, whatever comes to mind. What updates do you have since we last spoke?
Yes. Well, I'll go through two two case reports we're working on right now that are actually very, very worrisome on the mRNA technology. The first one, we have a patient. Now, I'm not a physician, by the way, but I'm working with Dr. Peter McCullough. But I am, we are working with these patients for research purposes. We have a patient who is a kind of an older man, not too old, about 50 years old. He received a few Pfizer mRNA injections. He developed multi-system lung vaccine syndrome. So he developed myocarditis. He got a pulmonary embolism. He has neurological symptoms, chronic fatigue syndrome, skin disorders, viral reactivation. So he's got the whole 9 yards of common adverse events from these shots. So we sent his blood to a laboratory in Germany, as well as tissue samples. And we actually found Pfizer mRNA is still circulating in his body in what's called exosomes. 3.6 years after his last shot, we found plasmid DNA fragments from the Pfizer vaccine in his skin and in a Grover's disease area. So kind of these small little lesions and bumps. Pfizer DNA was in there, as well as circulating spike protein over 3 years after his injection. He's never been infected, verified by antibody testing.
So he hasn't had an injection for over 3 years, though? Like no other boosters, nothing?
No. And we've been working with him for a while. And this is going to be the strongest case report to date on COVID vaccine injury. All of the tests have been done. There's been like 5 different laboratories involved. And so this really might help prove finally that all of our public health agencies and pharmaceutical companies committed fraud and blatantly lied when they said the mRNA would only last for about a week and would be rapidly degraded. They were gravely wrong. And in fact, it appears they were lying because it was impossible to know that. And so there hopefully will be, legal action as a result of this because it's that well documented. And then we have another case we're working on, which is more disturbing. This mother reached out to us, her young healthy son received 2 Pfizer mRNA injections, developed a heart tumor, a primary cardiac sarcoma, extremely, extremely rare. It metastasized to his brainstem, and he suffered a slow and painful death. And the tissue samples, the tumor biopsy samples were sent to this German lab, and we identified Pfizer plasmid DNA directly within the tumors, in these tumors that went from the heart to the brain. And so this is all horrible. So what we're uncovering now is worse than what we kind of ever imagined we would be uncovering, and it's not stopping. And so we're going to continue to put this research out to stop this disastrous program. And then there's 2 other studies that came out. If you want to talk about them,
you got the floor, Nicholas. I mean, yeah, let us know. Let us know what's going on.
Yeah. So these 2 other studies. We'll start with the first one. I mean, it's again, these studies are just shocking now. They had 51 million people in it. It was the entire population of South Korea. The entire population was included in this study, and they found a very strong signal of vaccine-acquired immunodeficiency syndrome, or what's called VAIDS. So what happened was, each as you increase the number of doses among these 51 million people, so 1 dose, 2 dose, 3 dose, 4+ dose, as you got more doses, your increased risk of other infections increased each time.
I'm sorry. So the South Korean, are we still referring to COVID vaccine? I wasn't sure that
Yeah.
Okay, so
Yeah,
apologies.
this was COVID mRNA injections,
Okay.
and so
And
when
the
they
entire
got the
population.
entire population, when they got the 4+ doses, the children ages 0 to 19 suffered a 600% increased risk of other infections.
Wow.
So this means, and again, you can't get a stronger data set than this. This means that VAIDS is real. This means that the immune system's becoming severely disrupted, dysregulated, and your T cells are becoming exhausted. They don't function anymore. They can't protect the body anymore against infection. And you have something called IgG4 class switching when, again, this is another dysfunctional immune response to these mRNA injections. And so now we just see the highly vaccinated populations are becoming highly infected with, and also with tuberculosis.
The more you discuss this, even from last time you and I spoke, it really seems more like this was like a bioengineered weapon against humanity. I'm probably getting conspiratorial, but it's like everything about this COVID vaccine seems to be specifically designed and engineered to break down the human body in some way.
Yeah. No,
crazy.
you're right. You're right. These are biowarfare agents. This has now been confirmed by the International Alliance of Indigenous Nations. They recently released a press release by their international tribunal that the COVID-19 mRNA injections are indeed biological weapons of mass destruction. And when we had Minnesota bill earlier this year, Shane Meckland, he introduced a bill declaring these injections biological weapons of mass destruction. And so, that's what these appear to be, unfortunately, simply because does look to be intentional, because we see all of these studies.
It does, huh? It does.
Yeah. But because they keep them on the market, they keep pushing them onto 6-month-olds in our states, in some states here in America, and that's intentional. And I think there will be severe criminal penalties for those still pushing these, in spite of all of this evidence. At the very least, mass negligent homicide.
Well, I would hope so. We still got Fauci walking around. I don't want to dive into that again, but just saying. In these studies you've mentioned, the ones we're talking about now, it was interesting that the first two, a lot of it was attributed to the Pfizer vaccine. Without getting you into trouble or putting you on the spot, because I don't want you to say the wrong thing here, but is there anything, for example, with the South Korean study, were they able to break down which vaccines, for example, whether it was Pfizer, Moderna, whatever, and the percentages of those vaccines that actually affected the populations?
Yes. I believe they did go through the types of mRNA shots, and they kind of all had similar risks.
They all had similar risks and results.
Yeah. They're not one of these appeared to be the most dangerous in this aspect. But that leads me, and I want to talk about the other study that did find specific brand differences.
Okay.
So there's other study, and I think it's even worse than the study we just talked about. This study had 3 million people from the U.S., and they looked at kidney outcomes. They compared about 1.45 million vaccinated to 1.45 million unvaccinated. And the vaccinated suffered about 80% increased risk of kidney failure
Wow.
And as time went on, they looked every month. As time went on, the risk kept increasing. So it's progressive kidney dysfunction leading to failure.
Who did this
didn't
study?
recover.
Who did this study? Do you recall?
Go on our Substack. It was actually Asian researchers.
Asian researchers?
It was Asian researchers. It wasn't even American researchers. It was, I believe, it was in the International Journal of Medical Sciences. I might be slightly off on that journal name, but yeah, I don't remember the author's
specific
first name, unfortunately. But
no worries.
these were for sure Asian researchers, and they looked at what's called the TriNetX data set, which has like 100 million people, and it does have all of this information of Americans. And so, yeah, they found this progressive kidney dysfunction, as well as 20% increased risk of all-cause mortality in particularly Pfizer recipients. So 20% increased risk of death. Moderna, they showed a protective effect, but we actually found they severely skewed the mortality results in this study because they excluded everybody that died after the vaccine within 3 months. So, I mean, come on, a lot of these people, they die, within a month. So if you exclude that 3 months, you're going to give a false protective effect. So what that means is not only was the Pfizer risk higher than 20% for sure, but that means for sure these other ones, Moderna, that had to be over. That had to be increasing the risk due to this, in spite of this severe bias that they employed. But that just shows how strong these effects are. It doesn't, sometimes even when they try and lower those numbers, it doesn't work.
So like I said before, one of my other episodes, I forgot who I was talking to, but we're talking about how data, we use data as a way to prove something, but you can manipulate your findings by manipulating the data based on like what you include or exclude, as you were just saying here. And we got to be careful, on the results. It always comes down to like follow the money, like who's funding these studies, for example. But some of these are errors, in this case may have just been they overlooked possibly, not including those deaths within the first 3 months, possibly, I don't know. The study you're talking about now, though, so this can all be found on your Substack, the McCullough Foundation Substack.
Yes, it's thefocalpoints.com, and you'll find this is where we report all of the studies. You'll find all the ones I've talked about, except the 2 case reports that we're currently working on. That's not available to the public yet.
How far off are you on that?
We hope, honestly, I want to get this one out on the Pfizer mRNA, 3.6 years after the shot. We wanted to get it out, honestly, for the past few months. We're just kind of waiting on this laboratory to finish the tissue staining and analysis. They're taking microscopic images of this diseased skin area to look for any vaccine components. So we're waiting on that, and hopefully within a month that'll be out.
Awesome, Nick. It's been about an hour or so, and I know you and I can keep talking. Is there anything else you want to add before we conclude?
No, that's it. I think. There's one more study. I'll just briefly
I'll give you one more.
it.
Let's go. Go ahead. Give us one more here.
86% of PCR positive COVID cases were not real infections. The German study just proved that.
Really?
And so, yeah. So basically, it was this was one of the largest frauds in history where people thought the cases were so high. They used these false PCR case counts to employ lockdowns, to force vaccine mandates, and for all sorts of horrible things. And it was all based on a fraudulent metric that wasn't even true. So again, this should be opening the door for legal action against this horrible situation that we went through in 2020.
I hope so. I mean, we need accountability. It seems like it's unattainable, but it's good to hear about these studies that there are people taking this serious, and they're not taking no for an answer. So this is all good news. Yeah. Outside of that, Nicholas, I thank you for being here. Once again, tell everybody where they can find all your studies, everything. I believe you said the focal points.
Yes, thefocalpoints.com, and then my personal X account, which is at
Right.
NICHULSCHER.
Gotcha. Hey, Nicholas, I thank you. You always have an open invite. If you guys have anything else come out, just send me a message, man. I'll have you on anytime. And again, thanks for the time and appreciate you waiting on me. I'm sorry, I was a little late on you.
Oh, no, yeah, you're good. You're good. Thanks for having me.
Oh, always. No problem, Nick. Thank you.
Devils hide behind redemption. Honesty is a one-way gate to hell.